frontal, temporal, parietal, occipital, and here's the external occipital protuberance, where the trapezius fibers, these muscles attach to. Alright, so here we can see the temporomandibular joint where they join, and then we have the mastoid process right here. The styloid process is kind of hard to see, but I believe it's right here. And then the external acoustic meatus is this structure right here. And the squamous part is also difficult to see, but you can see the suture goes around kind of in this area here. Here's the petrous part of the temporal bone, where inside you can find the cochlea and semilunar canals of the hearing system, and then you have the internal acoustic meatus, which is below this area where cranial nerves 7 and 8 pass through. Here we have the superior orbital fissure. Through here the ocular motor nerve goes through, as well as nerves cranial nerves 5 and 6. This is the lesser wing of the sphenoid. The greater wing, the optic canal where the optic nerve comes through, and then we have the sella turica down here. This is where the pituitary gland sits. This is the crista galli of the ethmoid bone. This is on top of which the olfactory bulb can be found. This is the cribriform plate that surrounds it on this side and this side. And this is where the olfactory nerves come through. Alright, let's take a look at the sutures here. First up, we have the coronal, which is right here. It's made between the frontal and the parietal. Then we have the sagittal, which is up here, made between the two parietal bones. And then we have the lambdoid, which is back here. It's right here. It's between the occipital and the parietal. And then there's the squamous, which is made between the parietal and the temporal, and it's kind of hard to see on this skeleton, but it runs here, goes all the way back. The maxilla, it's right here. The alveolar processes are right here and right here. Got the nasal bone right here. The zygomatic around here. It's made of two bones, one from the temporal bone right here and then one from the zygomatic bone. You can see where the two meet. You have the ethmoid, which is right here, and then the vomer, which is this bone right here, and the vomer along with the ethmoid make up the septum, which you can see. And then you have the inferior nasal concha, which found in this area right here. This helps in providing warmth, moisture, and cleansing when we inhale. Alright, now we're going to look at the mandible. This part here is considered the body of the mandible. Then you have the mandibular angle, and then the ramus of the mandible. This is this section here that goes up. Then you have the condylar processes right here. And then we have the mandibular Alright, we're going to look at the mandible now. So this is the mandible body, this section right here. Then you go to the mandibular angle. So you can see it angles up this way like this. And then you have the ramus of the mandible, which is this section that goes, this vertical section here. Then you have the condylar process right up here, the mandibular notch down here, and then the coronoid process is right here. Okay, now we're going to look at the vertebral column. We're going to look at the 4 different curves. First you have the cervical curve, which are the top 7 vertebrae up here. Then you have the thoracic curve, which are the next 12 vertebrae. That goes from here to there. And then the lumbar curve, which goes for the next 5 vertebrae. And it goes down like this and extends outwards. And then the last one is the sacral curvature, right down here. And that consists of 5 fused vertebrae. And at the bottom, it's not really a curvature, but you have the coccyx, which is 4 fused vertebrae down here. And the primary curvatures are made of the thoracic curvature and the sacral curvature right here, down here. So the sacral and the thoracic. Alright, now let's look at the sternum. Up top you have the jugular notch, and then the manubrium is this section right here. Here's the body, and down here hanging is the xiphoid process. Alright, now let's look at the ribs. First we're going to look at the true ribs, or vertebrosternal ribs, which are the first 7. 1, 2, 3, 4, 5, 6, 7. And then the vertebrochondral ribs, or the false ribs, which are the ones below it. So these ribs right here. 1, 2, 3. Okay, now we're going to look at the ribs, which is going to be a little difficult, but I think we can do this. Okay, now we're going to look at the ribs here. So we have the head of the rib, which is right here, then the neck, and then the turbuckle, and then the rest of the rib is known as the shaft. Ribs attach posteriorly to the thoracic vertebrae, which you can see. This is an inside view, and then when you look in the back, you can see they go behind the vertebrae posteriorly.